Hello, I'm so pleased to be with you here today to share some of our work toward climate mitigation and resiliency at Providence. And we're going to be talking about our climate management plan. I am Beth Shank, Associate Vice President of Environmental Stewardship for Providence. And Providence is a large nonprofit Catholic health system in the Western United States. As you can see here, we have 120,000 employees, 52 hospitals, almost 1,000 clinics, a university, a high school, and more. We serve in these 7 Western states, mostly along the west coast of the United States. Our locations vary widely from rural sites in Alaska, Montana, and Texas to urban hospitals in downtown Los Angeles, Portland, Oregon, and Seattle, Washington. We work with significant variation in geography, culture, politics, weather, and health risks. We also have a technology center in Hyderabad, India, called the Providence Global Center. In 2020, our president and CEO, Dr. Rod Hochman, announced our goal to work toward becoming carbon negative by 2030. Our leaders recognized that the problem of climate change was significant and that we could do something about it, and that the timing was urgent. So at the beginning of a pandemic, we set out to make significant progress by 2030. Environmental stewardship touches everything in healthcare, which is already complex, enormous, and often dealing literally with life and death situations. How could we also decarbonize healthcare? This is a visual summary of our strategic plan, and you see familiar terms, including mitigation, adaptation, and advocacy. I first draw your attention to mitigation, or reducing greenhouse gases to prevent further harm. The work is very broad, and people can get confused about what to do first. So we developed the We Act framework based on the input of content experts across Providence, which captures the primary sources of greenhouse gases, which are waste, energy and water, agriculture, food, chemicals, and transportation. Also, the mnemonic delivers an important message that this work is up to all of us, we. And the we means caregivers, leaders, board members, everyone across the organization. And the act reminds us that it depends on action with measurable results. We have strategies and goals in place for each element, and we are making progress on reducing emissions. The work is very data-driven, and we have gone all in on capturing, tracking, and understanding and sharing our data. We collect usage data for over 40 resources or commodities in terms of volume of use, cost of that use, and the carbon emissions associated with that. We have that every month for each of our 52 hospitals, and now we are adding hundreds of clinics. Having access to these data feels like someone turned the lights on. We can understand trends, efficiencies, best practices, and we have set benchmarks for each metric. Another key piece of our mitigation strategy is to understand and reduce carbon emissions from our supply chain, our purchased goods and services, and our capital. We developed an environmentally preferred purchasing policy, which guides everyone in the health system to consider the environmental impacts, including carbon emissions, when making decisions about purchases and contracts. It doesn't necessarily trump all other elements and concerns, but we ask people to learn more about what they are buying in terms of environmental harm. I want to draw your attention to our mission and one of our core values. Our environmental stewardship work in our organization is housed under our core value of justice. This is because our climate crisis and other environmental crises are justice issues. Those least responsible for the problems are those who are hit the hardest. Those who are least able to protect themselves are often the most exposed. This violates our commitment to justice, and this is a unifying issue for us in Providence, which is a deeply mission-driven organization. Okay, so back to our strategic plan, and now moving to adaptation. We signed the United States Department of Health and Human Services Healthcare Climate Pledge in 2022. One commitment we made is to develop a climate resiliency plan this year in 2023. Because of our commitment to justice and equity, we are addressing climate resiliency and adaptation, and we created a parallel strategy to our We Act framework for mitigation. We call it We Reach, indicating resiliency, equity, adaptation, climate, and health. We are talking with leaders, operators, engineers, clinicians, community members, community partners, government agencies, and others to strategize and weave together this complex work. For our We Reach focus, we are addressing this across 3 areas. First, our facilities and infrastructure. We have seen persistent high heat. For instance, the heat dome reaching 116 degrees Fahrenheit in Portland, Oregon. We have had to evacuate hospitals and long-term care facilities because of encroaching wildfires. We reckon with persistent smoke that harms health, and impacts our indoor air quality as well. We are including climate impacts in our emergency preparedness planning, supply chain resiliency, energy, and resource efficiency. Second, we are addressing the clinical delivery of care. Clinicians need to understand how heat, smoke, and mental health impact patients and specific diagnoses and conditions. We need to ensure clinician readiness and availability. Our pharmacists are considering the stability of different drugs in high heat and smoke conditions. And we are working on patient education to help people protect themselves during extreme events. And third, we are working to build resilience in the communities we serve. We have a 170-year history of community service, and we are expanding our lens today to adapt to current challenges. We work with community partners, with our community health teams, our population health teams, to try and reach different organizations, agencies, neighborhoods, and communities. Our organization made a significant commitment to health equity about 5 years ago with a $50 million investment to ensure that our practices and policies are equitable. Our work on climate resilience and justice aligns very well with our historical commitment to equity. So we are making progress, and we also have a long way to go. We're steadily decreasing our greenhouse gas emissions, optimizing waste, increasing our efficiency, and reducing costs. In fact, right now we're saving about $11 million per year through this work across the system, and we expect that to grow to $100 million in annual savings by 2030. Our initiative brings other value as well to the organization. We know that caregivers appreciate this work, and we believe the initiative is bringing new caregivers into the organization in part because of this commitment. We enjoy a position of being a climate leader in healthcare in the United States, which gives us the chance to learn from great minds and hearts around the nation and world. Thank you.